All right, so we're going to move on to the next national project update. So it's the Firefighter Cancer Cohort Study Update with a panel discussion with firefighter stakeholders. So I invite onto the stage, we have Captain Jamie Gabriel and Derek Urwin from Los Angeles County Fire Department, Captain Jeff Hughes from Orange County Fire Department Fire Wellness Agent and Orange County Professional Firefighters Association, as well as Chief Administrator Brian Kubie from Toms River Fire District, number 1 in Orange County, New Jersey. And finally, Dr. Jeff Burgess, a professor of Melanede Zuckerman College of Public Health from University of Arizona.
Great. Thank you, Natasha. So it's a pleasure to be able to speak with you today. This is an update on the FFCCS, the Firefighter Cancer Cohort Study, but I think the more important thing is understanding how firefighters are really determining what research we do and how we do it. So that's why we have our stakeholders, some of our stakeholders here with us today. So just a quick background on the FFCCS, as we call it. So first of all, it's the only national prospective, which you've heard a few times today, looking forward, multi-center, so multiple states, because again, they're doing great stuff with the FCI here in Florida, but cancer rates vary from state to state, and even within states, within different departments as well. But as you heard from the NFR that Dr. Fent just presented, that is also a prospective cohort study, but no biological samples. But these things all work together. We're not in competition. We, in fact, are synergistic. These things work together, and we've been talking about how to make sure that we fit into the NFR and vice versa. That's something that we're doing. But our goal is to, rather than the 200,000 firefighters that you just heard, which is necessary to really get good information, for in our case, it's 10,000 firefighters. We want to follow them for 30 years. You may ask, why 30 years? Because that's the latency period between exposure and onset of cancer for a number of different cancers can be as long as 30 or in some case more years. And we really want to understand the mechanisms by which exposures cause cancer. That's why collecting these biological samples like blood and urine is so critical. Some unique aspects of the Firefighter Cancer Cohort Study are that firefighters are involved in every stage of the process. So the research questions for each of our projects come from the firefighters. They're involved in the research activities, often collecting biological samples, in some cases with appropriate human subjects training, actually enrolling firefighters into the study. You'll hear that example, for example, from LA County today. And then looking at interventions and evaluating those interventions too. So outcomes that we are already getting from this study and that we expect over time are to be able to have biomarkers that both measure exposures and effects. So Dr. Jackie Goodrich talked with you about exposures from PFAS and the effects there being some examples. That with this information, we want to be able to develop individual cancer risk profiles. We also want to be able to use these biomarkers to look at the effectiveness of intervention and prevention trials, ultimately to improve cancer screening. And all of these things together should help us to both prevent cancer and identify it early when there's still when a better outcome can be obtained. Another way of looking at this is that the FFCCS is a Framingham study for firefighter cancer. A little bit about the Framingham study. This was started in the 40s when American, predominantly men, were dying of heart attacks, and we didn't know why, we didn't know what to do about it. So as a result of this Framingham study, which is also a prospective cohort study, we understood the risk factors for heart disease, things like high cholesterol, and effective interventions, things like aspirin. So at the end, because of the Framingham heart study, we went from not knowing anything to knowing how to prevent heart disease and how to reduce and treat it. That's the same thing that the FFCCS will allow us to achieve. There's too many partners to individually mention, but I just want you to realize that this is a big umbrella with multiple partners, and they're all essential to our success. Just so far, these are the states in red that are participating. Our goal, as we mentioned, was to get to 10,000. We are over 2,000 now. We expect, hopefully within 12 months, to be at 3,000. And what we depend upon, and also, if you want more information, we have a great website. Thank you, Alberto, for putting that together. He's a man of many talents, as you know. And so there's more information there at ffccs.org. So you saw this slide previously before. I think Jackie showed it. But it just shows you that so far, most of our grants have been kind of shorter term, but we're putting them together, 3 years generally. But together, under this big umbrella, we are able to do things much more rapidly, to add components very quickly. So some of the things you've heard about, the PFAS studies, we have other studies on women firefighters, volunteer firefighters led by Dr. Graber in Rutgers and New Jersey, and other volunteer firefighters and fire departments across the country. And then we just recently added wildland, for example, as well, working with CAL FIRE, also other fire departments in California, Colorado, and now Wyoming. You also saw this slide, but I do want to come back to it again, because the point of this is not just to watch until people get cancer. That's not it at all. The idea is prevention, and you can have prevention in different categories. One is measuring exposures and then reducing the exposures. We can use the biomarkers for that. Some of these things you could look at, the things in black, by the way, are things that we're already measuring. The things that are in red are things that we'd like to get to. That's kind of next on our priority list. But if we can measure the exposures, we can measure how to reduce them. From the perspective of biomarkers of effect, like the epigenetic measures that Dr. Goodrich had mentioned, we can also hopefully get to treatment. So there are actually some treatments that are out there that can reverse epigenetic effects. So those histone modifications, which are not what we're looking at right now, but this is not too far off. So again, we feel that we should have the science ready so that when those advancements are made, we'll be able to apply it for firefighters. I also mentioned here that it's not just cancer. We can look at other outcomes as well. We're already starting to look at reproductive outcomes in women firefighters, and actually some pilot stuff that you'll hear about today on male firefighters as well. We are looking at multiple different groups of firefighters. As you can see in that list of subgroups, there's still additional work that needs to be done. So the contributions to date have been substantial, but this is just starting out. We have a lot more in the pipeline. So from the idea of this identifying mechanisms causing cancer in the fire service, when IARC, the International Agency for Research on Cancer, last reviewed firefighting, one of the reasons that it didn't score so high, if you will, that it's possibly related rather than probable or known, was a lack of information about the mechanism by which exposures could cause cancer. And from these FFCCS and the study that immediately preceded that we were doing with Tucson Fire, we've been able to identify these epigenetic mechanisms as a potential link between the exposure and increased cancer risk. So that was actually used by the committee that advises IARC that it was time to come back in and review this again, along with other studies like the NIOSH study of the 3 cities that Kenny Fent had presented. So it's all together. All of this is important research together. We also found epigenetic differences between minority firefighters, in this case Hispanic firefighters and non-Hispanic white firefighters, that may explain why Hispanic and black firefighters in California have 6 cancers that non-Hispanic white firefighters don't have. So again, this I'm not saying it's all the explanation, but it is at least an explanation for that change. And you already saw the work for the PFAS, so I don't need to go over that again. From a prevention perspective, we've shown that the wipes that you can use after a fire, we already know based on the great work that Kenny Fenn and others have done that you can remove like 85% of PAHs from the skin with wipes. But we've actually shown that in addition to that, you can reduce substantially the toxicity of those chemicals by looking at, again, effects, not just exposures. And with work with Tucson Fire, using this exposure information, they chose interventions, putting engineers on air and fire scene washdown. And if you see Captain John Galata here, John, if you want to stand up for a second, wherever you are. Hopefully he's still in here. There he is. Okay. Ask him about those things. So they selected those interventions. We studied them. We showed that they reduced urine PAHs, a measure of exposure, by between 33 and 40%. So again, showing the effectiveness of these particular interventions. And then if you put everything together, the biomarkers and the information from surveys, you can get great information. So again, coming back to Dr. Graber and her great work with volunteer departments in New Jersey and now elsewhere, she showed that the PFAS levels were actually, at least one particular PFAS, was associated with the number of years you worked as a firefighter. So with that, I'm going to go ahead and hand this off to my firefighter colleagues that can give you some examples about how they've used the structure of the FFCCS.
So I'm just going to take a minute here to talk a little bit more about biomarkers and why that's important to firefighter cancer research from kind of the fire service perspective. So one of the most important aspects of firefighter cancer research is, in fact, studying these biomarkers. You're all well aware that the fire ground is full of chemical carcinogens and that these are compounds that cause cancer-promoting genetic and epigenetic changes that contribute to our elevated incidence of cancer in the fire service. And while it's very important to quantify things like the 16 EPA PAHs in environmental samples, there's many, many more PAHs and other chemical carcinogens on the fire ground that are not quantified with standard approaches. And you definitely don't get any of the information about those cancer-promoting genetic and epigenetic changes without collecting and analyzing biological samples from firefighters, and that's one of the big focuses of the FFCCS. So with biomarkers of exposure, to understand what a firefighter has been exposed to after a fire, we have to measure specifically biomarkers of exposure, such as hydroxylated pHs in urine or exhaled benzene, muconic acid, which quantify some of the chemicals that have gotten into our bodies. But again, this is only a part of the picture, as we typically quantify lower molecular weight PAHs in urine samples, while many of the higher molecular weight PAHs that are highly genotoxic are preferentially eliminated in feces and thus not measured in a urine sample. So to give this a little bit of context, you can kind of think of this like a person standing outside exposed to the passing weather. If you're only measuring the rainfall, then you haven't measured the hail or the lightning that might be doing the real damage. And more importantly, you haven't assessed the injuries to that person exposed to the elements. And that's what really counts when it comes to us putting a dent in cancer in the fire service. So what's really most important when it comes to the things that we're concerned about as firefighters is measuring what the chemicals that we're exposed to are actually doing to our bodies by measuring biomarkers of effect. To do this, we have to draw blood from firefighters and look for things like DNA mutagenesis or changes in microRNA expression or DNA methylation. These are cancer-promoting cellular changes that can be measured and hopefully in the long term be used to develop cancer risk factor assessments for firefighters, which we don't currently have. And this is an area of focus for the FFCCS and a big reason why we have enthusiastic participation in the study from a number of fire departments. And I'll hand it over to my friend Jeff Hughes here to talk a little bit more about that.
First, the smart guys talk, then they let the old guy on here. We're very lucky as firefighters to have science and research like the FFCCS that can really listen to firefighters and put science behind what those issues are that we're worried about. The OCFA and LA County, as well as LA City Fire, is also involved in some of these projects. And together, the goals are finding those answers rather than just, boy, it seems like a lot of firefighters get cancer or other things. This is the science behind that can really help, and the firefighters are involved. This project needs champions. You guys are all champions. You're here, you came across the country or across from different parts of the country to listen to the science behind this stuff. You guys can take part in this. You can talk to the researchers and say, hey, what about certain things that can possibly lead to cancer? You know, that might be something, a future project. Currently, the OCFA and LA County are mutually involved in a few very important projects. Women in the fire service, they have different exposure risks and health risks than white males. A lot of the projects that you see published reports were done by science that shows mostly white male firefighters. Well, there's other things that we need to look at. Female firefighters, very important study. The wildland-urban interface, California, we got plenty of those going on. We got plenty of ability to get out there and collect urine, which we'll be discussing a little bit about the hard work that LA County and Orange County has also helped out with. The live fire training cadre, those folks are in that environment and really seeing those toxic levels of the amount of work that they're doing in live fire training. The PFAS research, that picture there that shows Dr. Burgess on top of our crash rig at John Wayne Airport, that's only part of it. Some of the help that we're getting with NIOSH is also that information about what about the PFAS in our turnout gear and how much is that making its way into our bodies. And then our investigators, probably the most exposed folks that we have on our department. Those guys are often going from call to call to call. They wear clothes that I feel that they need to protect them more. We've made some great changes, but we still got some more work to do. I know we got some investigators in here, and they know exactly what I'm talking about. But it's hard to get an investigator that's going to be doing a dig out for multiple hours or multiple incident scenes on the same day to wear an SCBA the whole time. But the difference in their level of protection, SCBA to a PAPR or an APR, it's a huge difference. Dr. Burgess behind me also mentioned some of the other projects, the female firefighter reproductive outcomes. It's really important in that there might have been, there's concern over female low birth weights and maybe not making it to full term with their babies and what's going on. Not just the cancer risk, but actually looking at the female firefighter and the reproductive outcomes. That other picture for the male reproductive outcomes, those are my two wonderful kids. And my son Jeremy there in the chair, he's 27 now. And the question that I had for Dr. Burgess, and this is where you guys can come in talking to the academics, how we describe the possibility of cancer starting in firefighters can be a damage to your DNA. So my question was, well, what about the DNA damage? Could that be passed to an unborn child? And you start talking to other firefighters and hearing a high number of firefighters that have children with special needs, whether it's on the autism spectrum or other things that might be going on. Science can help with that stuff. But it takes champions like you to maybe raise that question and then follow through, get involved in some of the work that goes into the data collection and then interventions down the road. I'd like to pass that on to my colleague, Captain Gabriel. She'll talk about some of that hard work that she does there in LA County.
All right, thank you. So one of the unique things with this FFCCS, and something I've been really excited to be a part of, is this collaboration with firefighters where we actually get certified to consent fellow firefighters into the study and collect our own biological samples. So by getting those firefighters IRB trained, becoming research assistants on the study, within our department, under the approval of our medical director, paramedics like myself, I can draw those blood samples, and we're able to do the full consent enrollment, all of the biological samples, and those follow-up biological samples with our resources in our department. And the initial onboarding using this badge-to-badge community-based system has really shown to us better involvement from the firefighters. So the fire culture is very much one of family, and when we come into the fire station or we come into these training facilities, we're not seen as outsiders coming in asking for something of them. We come in there, we're part of the brother and sisterhood, and with that perspective, we can really get the firefighters on board with the study, get their participation and the longevity in the participation, which is so important in a study that's going to be 30 years long. So another benefit that we get with the badge-to-badge model is also the logistical benefit, because we're trying to qualitatively measure our pHs in our urine after an exposure. So that means we have to get urine samples in a timely fashion after these exposures happen, which are complicated and unpredictable events. So having the firefighters that are able to get out there and collect these samples, we're going to be able to get more of that data so we can find more stuff. So for example, we had our WUI study we had these, we're looking at wildland firefighters in the wildland-urban interface, and we need to go out to these wildland fires that are geographically very large. Firefighters are dispersed in different areas of the fire, so that's a challenge. You need someone that's collecting the sample that has an understanding of the incident command system so that they can understand where to find the firefighters, how to get access to them. And then because these fires, which are burning for days or weeks at a time, there's inherent dangers with the fire, which means non-firefighter research assistants would most likely be denied access to the operational area. So we need to have, it's vital that we have those firefighters that are able to collect the data because they can actually get access to physically get those samples. So what we did in this study is we had these kits that you can see up here. They're urine collection kits. These were kept on the engines, the strike team engines that were enrolled in the study. So while they're out on the fire ground, once they met the time limit of exposure that we were looking for, they could collect the samples themselves, keep them cold in these packs until they could get picked up. But we still physically had to get out to that fire and pick up these samples so that we could store them properly, freeze them, so that they'd actually be viable to get that data from. So here we have a picture of Derek Urwin. He's got the hose pack on, and also Captain Jeff Camara, one of our other research assistants on the study. And this was out on the study, him hiking the line to pick up the samples. And as all good firefighters know, you don't ever come to a fire without something. So he's got these hose packs. He decided to pack in on his own some extra hose packs to take to the engine crew. Not necessary, wasn't asked for. But understanding those cultural nuances of the fire department really helps with getting the participation and involvement. It's a better experience for those firefighters, and more likely they're going to stay in the study with us. Then once we've collected all these samples, now it's just a matter of us shipping it, packing it up in ice or dry ice, depending on what sample we're doing, and we're going to send it out to our academic research partners where they can really start the heavy job of analyzing and assessing that data. So one of the great things about this study and having this collaboration between the research assistants and the firefighters involved, as Dr. Burgess mentioned and Jeff Hughes went over with some of the subgroups, these studies and the aims of the studies are driven by the firefighters' needs and the questions and concerns that we have. So with that, we can take these answers, we can have research-based scientific data to then drive our policy changes and drive and implement changes so that we can reduce those exposures and ultimately reduce the risk of cancer in the fire service, which is really what the point of this study is. So with that, I'm going to pass the mic to Chief Kubie, who's going to talk about the next portion.
I just want to talk a little bit about CAPS. The journey for the volunteer fire service for me started in Phoenix, Arizona, when I went to the first Firefighter Cancer Symposium. It was important because not only did I hear all the good information that we heard about the cancer study, I've heard numerous times in that study we need to get more volunteers and wildland firefighters involved. When I returned home to New Jersey, I made an appointment with the executive director of a local hospital, which is part of RWJ Barnabas Health System, and talked to about this initiative. And after hearing his response and feeling a little defeated, I didn't know where to go. So I was at an event, and I bumped into an individual named Jack Mars. And I explained to him the whole situation, and he said to me, he said, I am the chairman of the board for RWJ Barnabas Health Corporate Board. He said to me, I want to introduce you to Dr. Labute in Piscataway. I'll give you a date and time. Don't miss it. Don't change it because it's not going to happen. So I went to see Dr. Labute, and Dr. Gabriel was there. And I am honestly forever grateful to Rutgers, the Barnabas Healthcare System, and that was the start of CAPS for volunteers. We do have some challenges. Unlike some of my partners, we don't have the resources, so we have to rely a lot on our academic partners to do the data collection, the sample collection, and take care of it, because we don't have paramedics and EMTs in our employ. As we go on, RWJ Barnabas Health funded it for the first 2 years. After that, we applied for a FEMA grant for 3 years to expand it outside of the Toms River Fire Department. We brought in additional fire departments in New Jersey. We're now, with the help of academic partners in Washington, Tennessee, and Illinois, we are expanding the program nationwide, and I would think by the data we're collecting, by April of this year, we'll have about 600 volunteers enrolled in the program, which will be about 25% of the overall enrollment. This is some of the information, the data that came out of the service, the studies, that when we compared the volunteers to career, the average volunteer has got 20 years of service and at the age of 47. When you looked at the career data collected, the average years of service was 10 and the age 37. That means a lot when we come down to this, because we have a lot of years of service difference, what were we exposed to, and some other issues. And then we went into the obese factor, why, and one of Dr. Graber's research students, Nimit, started looking at obesity and physical fitness in the volunteer fire service. As I will confirm with Dr. Jenke's presentation this morning, I will tell you that what we did learn is that we are obese later in life for volunteers. That is a big problem for us, and we're trying to figure out how we're addressing it now. NIMIT is not done, but we are working on it. The other study that came out, we looked at PFAS studies, and in the study just in Toms River, and it was early on, we learned that we have some PFAS levels elevated in our study in Toms River that are not in any other study right now. So we're looking at why is that occurring in the volunteer fire service. We're going to relook at it now that we have all these other volunteers enrolled from different states to see, is it just unique to Toms River, or is it a volunteer issue, and what's causing that? We don't know. With that, I will leave it to questions, but lastly, I am forever indebted to Rutgers University, Dr. Graber, Taylor Black, and Katie is here, a PhD student. She's more excited about research and volunteer firefighters than I think I am. But with all of you out there, whether you're a volunteer or career, it doesn't matter. This disease is non-discriminatory. It doesn't matter. We're all in this together, and I'm hoping that we can find solutions to this so we're not burying our brothers and sisters.
We're happy to take any questions if we've got a few minutes. Looking for Cynthia, who is our timekeeper. Any questions? Okay. Is there anything online? Do we know? Okay. All right. Thank you. Again, we're all available to answer questions if you have any.